Hi, my name is Dr. Niemann. Just wanted to talk to you more about the Lapidus procedure. As we've discussed, a Lapidus is a procedure that fixes bunions. As you see online, a lot of times you'll Google bunion correction and so forth, and the term Lapidus will come up. Lapidus is a very common name that people are using in a way of naming products after the way you fixate the bunion, fixate the procedures. Fixation is the screws that we use to fixate the bunion itself. So when you look at this patient's pre-op view, we're looking at this bunion right here. So you're looking at the bone and the alignment of this bone. So the direction of this bone, right? The direction of this bone, in a way, we want to correct this bone going this way as well as down, and also rotating the head this way. Okay? And the way you see the rotation is you focus on these little bones. So a couple of discussions today. We want to go over the Lapidus procedure. When you look at the indications for a Lapidus, you're looking at the position of the first metatarsal relative to here. Okay? So the patient doesn't have a wide angle, but ultimately she has a very elevated first metatarsal. When we look at how we correct the Lapidus, we're basically trying to correct this bone from here to here, as well as we're putting it downwards, and we're also trying to rotate that bone. And the way you visualize the rotation is you see these two bones, which we call the sesamoids. And as on the post-op x-ray, you'll see kind of how the sesamoids will sit more underneath, okay? And the alignment of the joint will be improved. So when you talk about a Lapidus, you're basically fusing this joint through here, okay? This is the metatarsal cuneiform joint. And so what we do is remove the cartilage here, okay? Position the bone, and fixate it with screws or plates, okay? I typically use 2 screws, and what you're looking for is really no line of separation between the 2 bones. This is her post-op 2 weeks x-ray. Over time, as we look at x-rays, you'll see that these 2 bones will grow together. So basically it's a fusion of these 2 joints, okay? The screws will usually sit inside the bone and not have to be removed at all, okay? But what you're looking at is the position of this metatarsal relative to this metatarsal, so pretty good alignment and really a very congruent joint in the way the sesamoids sit. We did shave a little bit of the bump off, so you can see she had a little bit of erosion on this bone, and we do shave that off. She still has some swelling along this area, which will come down over time. Okay. So on our lateral view, we're looking at the position of the metatarsal, which is this long bone, relative to the second metatarsal, which is this bone. Ideally, you want to see these kind of almost parallel to each other. So as you can see on this view, you don't see much of a distinction between the top of her first metatarsal and the second metatarsal. She's only post-op 2, so she's not fully weight bearing on this foot. So it's not the ideal image, but ultimately at the end, you'll see that the position of the metatarsal is placed down, and you're ultimately looking at a nice trajection of bone through here down to the ball of the foot, okay? So this is another patient that you can see kind of the severity of his deformity. Bad bunion, hammer toe, very tight second metatarsal joint, very long second metatarsal. Okay. So what we did with him is we definitely did the Lapidus, where we fused the joint here, shave off the bump, and you can see how the sesamoid bones are in a lot better position. Now you can kind of see this nice congruent joint, versus here you just don't see much of a good joint. And then we shorten the second metatarsal, which kind of brings that joint decompressed. So you can see the difference between here, the space between the joint, very little space if anything, because the toe is just sitting on top of the knuckle. And so as we shorten this, you can kind of see the difference in the length here versus here. And then we pin the toe, where you can kind of see the full toe at its length as we pin the toe. And so the pin will stay in there for about 4 weeks. Screw stays in there for life, and then again we're looking for the fusion of this joint over time. So this is another patient where we did perform a Lapidus, but we incorporated it in more of a flat foot. Okay, so you can see on her lateral x-ray, just a very collapsed foot where you just kind of see this big sag in the arch, okay? So for her, what we did was we did a bone cut of her heel bone to slide it over, and then we did the fusion of the midfoot. So in the long run, we're trying to create this nice linear projection of her arch that comes in this position, okay? So we'll perform a Lapidus in ways that also are part of patient's flat foot correction, okay? So here, if you're looking at the foot top to bottom, on our pre-op x-rays, this little ball and socket, you can see kind of how this bone just projects in this direction. So our foot just is rolling in, okay? What we do is, by sliding the heel, it covers this bone up better. And then we fuse this part of the bone to stabilize her arch down. So this is kind of the same type of procedure where we use the same fixation, fuse the mid-tarsal joint, and basically align her big toe. You can kind of see a little difference in her sesamoids versus now, but just a different way in which we use the Lapidus or that mid-tarsal fusion as a correction for someone's flat foot.